If you have wrist pain, you know how incapacitating it can be. So let's look at the anatomy, and then let's show you how the BioZoom can help relieve some of that tension around the wrist. Understanding the anatomy of the wrist involves understanding all of the muscles and ligaments that come down from the forearm and attach into the wrist. When we target the areas, we'll be relaxing the muscles that attach into the thumb. We will be working on the muscles that control finger flexion, and it's also important to make sure that the forearm is relaxed. As you can see, all of the muscles with the tendons come from the forearm. For the attachment, we want to get a little more isolated because it's a smaller area. We're going to use the red tip. We're going to use the 5th setting. And we're going to target a 60 to 90 second cycle. But with the wrist, begin in the palm, hand in a neutral position, slight circular motions through the palm. Place your hand on your knees so that you can apply deeper pressure without it vibrating. Make sure you get the meaty part of the thumb as it extends out into the finger. Slight circular motions. Travel all the way up to the fingers. Proceed to the outside. Once you hit the area of the carpal tunnel, stay a little lateral or a little outside the center to avoid direct pressure over the center area where there can be some delicate nerves. Work your way up the forearm muscle to the elbow. Move sideways. Turn the hand over. Work your way down the muscle towards the back of the hand. Do your first pass in neutral. Extend the wrist. Repeat the pattern down the outside of the forearm. Continue on the right side. Finish off with doing a second pass on the wrist. Do several different passes on the wrist and the arm. Spend 60 to 90 seconds. Don't forget the meaty part of the thumb. Repeat that 2 to 3 times a day. Usually after several days to several weeks, you'll notice a significant difference in how the wrists feel.